Hi everybody, this is Dr. Pratista Strong from Kathmandu Clinic. This is kind of a weird video for me because I'm looking in a mirror. I wanted to give everybody a tour of my space so that you could see how you can build your own micropractice with not very much space and very low overhead, because that's kind of my key. So this is, each space is different in how you kind of set it up, and it'll hopefully just click in how you want to set it up, and especially depending on what type of patients you're seeing and how you're wanting to set that up is going to be all individualized, of course. But for me, I wanted to see just general practice patients, because I'm a general practice physician, and kids all the way up to old people. So I ended up in a very small office. It's one office in a multi-unit suite. And so here is the door. I'll show you my door. And I don't want to open the door yet or at all, because there's another provider over there. And so my kind of thought process was, as somebody, again, a multi-unit suite that's very busy out there, but I try to create a space that once you come in through the door threshold, you're kind of in the clinic. So my thought was to have this kind of screen thing if somebody were to want to change, like right here. I set this up about from right here, and so when patients are changing, it's very easy to just kind of have this right at the door, and if they wanted to go to the restroom, they can come in and out very easily. And the other thing I have, I'm going to show you really quick, is this, and that is a curtain, because there's somebody over there, so I don't want to make too much noise, but it's a curtain, so even if the door is open, it's still private. I have my scale here, very accessible, and I usually take my shoes off just to keep my office clean. And I'm like Mr. Rogers. I have my own little Nepali house shoes here that I usually wear. And so this is kind of what it looks like when you walk in. So this is the whole room. I'm going to pan here and show you the entire room. Just a commercial room that looks very cozy, because that's kind of the vibe I was trying to get. So I developed this little thing I put on my mailbox outside for when I'm seeing somebody. It's just a laminated piece of paper. Things just kind of evolve, and when I'm with a patient, I put that up there. Like I said, things just kind of evolve when patients are confused about coming in or not. I just kind of made that up recently. So I have a chair here if somebody wanted to sit and just do vitals and leave. I have that set up. And also, if there are elderly people that can't get in and out very easily, I kind of want to make it something accessible for them. I have this, my clock. I have some display things that I kind of set up here for some of the Ayurvedic herbs that I've been using lately. And so I have that all kind of hidden in here. I have this drawer so these are all my linens. So I have a couple of sheets in here. I have 2 gowns that I got on Amazon, a pillowcase, so 2 pillowcases I got, and a couple of pants that I felt like were necessary because I do manipulations, so I like my patients to be in comfortable pants. And then this is just kind of extra storage, really. So let's see, what else can I show you? So my biggest purchase was this bed, this folding bed, and it's from OMM, the company OMM, and I use this as my my exam bed, as my OMT bed, and as my gyne table. So I don't actually have a traditional bed. I have a pillow, nice IKEA pillow that's nice and comfortable for people. And how do I do gyne exams? Well, I got this wedge, and so you lay a patient down and you put this under their butt, and voila, you can have a gyne exam very comfortably and easily. So I love that. That is a must purchase for people wanting to do well women exams. So here's
kind of the decorations. I wanted to make sure I make it, like I said, as comfortable as possible. Got a rainbow maker, plants. Those are all kind of fun things. I have a really comfortable seating area here that